Okay, the subject today is chronic Lyme disease, more evidence that it is autoimmune. Dr. Martin Rutherford, I am a certified functional medicine practitioner and a chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
We did an article, or we did a presentation in this venue on Lyme back in the end of February, was it? And we indicated that it had now been confirmed that Lyme was an autoimmune problem, something we had surmised for quite some time. We had viewers comment on the fact that they thought that everybody knew that it was Lyme was autoimmune, but indeed it was out there. People were surmising, but up until February night, there was actually no real clear verification. And then this article came out, and it was a journal article, which Dr. Gates is more conversant with as far as what the article was and where it was published. But the article indicated that indeed there was an autoimmune component in which an MMP10 enzyme, which is an enzyme in your joints, for all the people in Lyme who start out with joint pain, gets attacked. It's an enzyme that helps to clean collagen out of the joints. Your immune system cleans out all the dead tissue in addition to killing antibiotics and viruses. And that once that relationship is established, that you have developed an autoimmune problem, now it's kind of off to the races. And then there's a lot more complexities to that. But now what we find is that, and what Dr. Gates informed me of this morning, about 30 minutes ago, that there is even more evidence coming out. And it's kind of interesting because we've been at this for a while now, and we'll see a lot of these things in clinical practice, and we'll be savaged for saying the gut caused this, how stupid, how could that be? And there's no such thing as Lyme disease and so on and so forth. And then all of a sudden, everybody got onto the gut. Now there are teams, there are legions of researchers researching the gut every day, which is a good thing. And now it sounds like maybe the same thing is happening with Lyme.
Absolutely, absolutely. And I kind of wanted you to paint the picture of what the Lyme disease patient goes through, because this is such a confusing, muddled topic. There are people who potentially maybe don't have Lyme that are diagnosed with Lyme. Yeah. I think we should go through that. There's just a lot of uncertainty on some of the testing. While there are definitely people who are infected by the Lyme, spirochete, who come down with chronic Lyme symptoms, who are then oftentimes, disregarded by their doctors as having any symptoms of any validity. And so that creates a lot of confusion in this whole world of Lyme disease. And I was wondering maybe you could go through that before we go into the nuances.
Sure. Personally, I've kind of gone through the same thing. I've never been diagnosed with Lyme, but in retrospect, when I went to the seminar, the osteopathic rheumatology seminar, there was a gentleman there who had been president of the Lyme group. What would it be?
Is
the
it
Lyme
Iliads?
Association.
I think it's
Iliads. Yeah, Iliads. And he had been president of that for years. So he was the head guy of Lyme. And he was later telling me, of course you have Lyme, you should get checked for it. Now, I was feeling a lot better by that time. But the point there was that their position was everything is Lyme. And everything that I had was Lyme. I have fibromyalgia, peripheral neuropathy, celiac, I had chronic fatigue, and I have Hashimoto's thyroiditis. I don't think we ever checked to see if I had antibodies against my cerebellum.
Well,
but we probably do.
I'm not going to violate your HIPAA rights here.
You can.
It's okay.
So anyway, the bottom line is the Lyme patient went through this. I went through the same thing as a Lyme patient, and who knows? Maybe I do have Lyme. We just never bothered to test for it because I was doing fine. So here's the Lyme patient's, conundrum, or here's the history. So you're going along, and maybe life is even good. Usually you're going to have some sort of a history that you're not even aware of, that somebody in your family probably had some sort of an autoimmune problem. Like for me, I had a family that had thyroid problems. I had an uncle that had MS. I had another uncle that had Parkinson's disease, and so on and so forth. But I was going along fine. Then for me, I got an overwhelming pneumonia. And at the same time, I was undergoing a lot of stress. And the next thing you know, the Lyme patient is same thing. You're going along, everything's fine. And also one day there's a trigger. Maybe it's a stress. Maybe it's a trauma. Maybe you just had your third child. Maybe it's an overwhelming infection. Maybe it's a surgery, which would be equal to a trauma, and there are a few others. But something, all of a sudden, you start getting symptoms you haven't had before, and then the next thing you know, you start getting, like, maybe you start putting on weight, maybe you don't, maybe you start getting pain all over the place, maybe you get tremendously fatigued, maybe you start getting dermatitis. I mean, the list of symptoms that you can get is endless, literally, and we'll probably cover it as to why before this is over. So you take off to your doctor. And it's not my experience, even as a non-Lyme patient, that doctors immediately start saying, oh, maybe you have Lyme. Pretty much, you go from doctor to doctor to doctor, and then you're treated for one symptom or the other symptom or multiple symptoms. Usually patients come in here with multiple bags of supplements and drugs and things of that nature. And basically, you're not getting any type of a response. Finally, maybe you hit a GP that ultimately says, because there's a pattern here now, you have to go to several doctors to get somebody to think about this. And maybe the GP finally says, maybe you have that Lyme disease. Now, ironically, even though there's still people in the medical community, maybe that'll change this year, that don't believe Lyme even exists, the GPs are the guys who kind of sort of get that it does exist. They just don't know what to do with it. So they test you for Lyme, and maybe you have it, maybe you don't. Maybe you don't have it, okay? Maybe you don't have it, and then they send you to a rheumatologist or whatever. At some point, maybe somebody just says, let's just give you antibiotics and see what happens. And maybe they give you the antibiotics and the antibiotics don't work. And so now not only are you taking antibiotics and they're not working, but they're damaging your gut. And if you've ever watched anything we've said before, 70% of your immune system is in your gut. So that starts creating problems. Next thing you know, you're on the internet. This lady I was talking to yesterday in Florida, by the way, she was so cool. She was really all over this stuff. And she says, so you're on the internet. Next thing you know, you start researching. You start researching that the medical doctors really don't want to treat you unless you have the bullseye rash. That's part of the confusion when you get,
and especially it's the acute phase of the infection. So
and they don't want to treat you unless you had the bullseye rash 3 weeks ago.
Right.
But by the time you get to a doctor, oftentimes it's months or years.
Yeah, and the bullseye rash may only be there 40% of the time or 70% of the time.
Right.
So some
and you may not have had it. So if you don't have it, the doctors definitely weren't going to take you seriously as far as it being Lyme. And if you had it, then maybe they'll try the antibiotics. And if the antibiotics don't work, it's off to the internet. And now you start reading all kinds of things about what causes it. And you can get it kissing somebody in a bar, and you can get it from just about any bug that there is. And there's all kinds of theories out there. But you start reading the symptoms, and you're absolutely certain that that's what's going on. Maybe you go back to your GP with this stuff, and the GP still says, well, you didn't really have the bullseye rash, and you had it for like 5 years, so I don't know what's going on. And so at that point, you've hit a wall. So you go back to the internet, and you start looking at things. Maybe you start looking at Lyme literate groups, and the next thing you know, one of them says, hey, go to my doctor. He's a Lyme literate doctor. So now you go to the Lyme literate doctor, and the Lyme literate doctor acknowledges that, you probably have Lyme. These guys really aren't conversant. The medical profession's really not conversant with it. And so, we do the ELISA, and then we do the IGenics, the Western blot, and then we do the IGenics, and then, and they do that as a standard, which isn't necessarily the way that the infectious disease control societies group says to do it. So they have a little difference there, and they say, but the infectious disease people don't know what they're doing. We know what Lyme's all about. And even though the literature is replete with data that says that these tests are not really that accurate, they're done. You show up with a couple of bands in your IGenics test, and then it's off to the races. You go to the doctor, back to the antibiotics, because the part of the major armamentarium, how's that for a word, of the Lyme literate doctor is kill the bug, kill the bacteria. In an article that we wrote on this, we indicated that they would kill the bacteria for anywhere from 3 months to 6 years. We didn't make those numbers up. We've had a patient come in here who had been on antibiotics for 6 years for Lyme. And for those of you who are even remotely conversant with antibiotics, you'll know there's a lot of people out there that say that's not a very good thing to do. Lyme doctors will say it is a good thing to do. And so now you have this going on. So now you start taking the antibiotics.
And we've seen people who've taken the antibiotics and felt better.
I was just going to say
clarify that.
I was just going to say that.
Mm-hmm.
And you start taking the antibiotics, and they do and I think the more successful one seems to be the pulsing.
Mm-hmm.
And they pulse it, and so because these little spirochetes kind of hide from the immune system, and they create something called cysts. Then they don't hide, then they hide. So they show you the dark field microscopy, and then they're gone, and then they go, oh, they're gone. But they hide, they come out, they hide, they come out because they're evading the immune system. So they pulse antibiotics to try and nail those little suckers when they come out. Okay, and that can work. Now, if it doesn't work, which I don't know what percentage of the time it doesn't work, but it's a lot. But if it doesn't work, now you're off to the co-infections. Now you're off to maybe it's stress hormones. You're off to more medicines. You're off to more supplements.
Heavy metal toxins.
Now you're off to the infamous heavy metal toxicities, food allergies, and more. And depending on the doctor that you know, so it's kind of Katie bar the door. So now you're getting drained emotionally. You're getting drained financially. You're really kind of starting to get that we're at the point of let's try a little bit of this, let's try a little bit of that, and let's keep our fingers crossed and let's pray. And the average patient who comes here just kind of disappears from that practice. They just, at some point, they just go, okay, this is not happening. You know, I only have so many funds left. I have to live for the rest of my life, things of that nature. And that's kind of the flow that we see by the time the patient gets here. And there's a little bit more to that. We have an article that we wrote. You can pull it up on powerhealthtalk.com. It's like a 3-part series, and we review all of that in more detail and more. We wrote it, I think, a couple months ago. That's kind of the flow
That's very much
of what's going on. And the problem is, once we discuss the fact today that there's more acceptance that it's autoimmune, is that all of these methods that are being used on you are more or less acute methods. In other words, there are patients who get the bullseye rash. Lyme does exist, okay? We know Lyme exists. You get the bullseye rash, you go in, you get in there within the first week or two because for some reason, miraculously, you are aware that you should do that. Not many people are. And then you get in there and then they give you the antibiotics and you get better. You get better. Okay, we've had patients who've come in here whose wives have come in. They had the Lyme, they had it, the husband had it. He got the antibiotics, he got better, the wife didn't. So there's another component to this, and the component is this. Even if you get better from those antibiotics, and especially if you didn't get better from those antibiotics, at that same time, we now know that your immune system is making antibodies to a seemingly totally unrelated enzyme in your joints called the MMP10 enzyme. And that enzyme cleans out the joints. And at the same time, you have developed an autoimmune problem. Even if you get better from the antibiotics, you may then get another trigger later on in 6 months, a year or two later, and all of these symptoms will explode and you won't understand that there's a connection there. And why do you get the eclectic symptoms? You get the eclectic symptoms because of this. Most people don't have one autoimmune problem. Most people usually who get these severe reactions may or may not know that they're already compromised. They may be compromised by a bad gut that's altering their immune system. They may be compromised by stress hormones, or they may be compromised that they have an autoimmune problem they don't know they have, or they may be compromised genetically, okay? And so now you get this MMP enzyme attacked in your joints. Well, I don't really get joint pain. Okay, but if you have any of these others, maybe a thyroid problem that is called Hashimoto's. Maybe you have a low-grade rheumatoid arthritis that you know you have or you don't know you have. Maybe you have lupus that you know that you have, that you don't know you have. When this joint later on gets attacked, it doesn't just flare up joint pain. It flares up your Hashimoto's, your celiac, your cerebellar antibodies, your immune system, and now you have, remember when I said every symptom known to man, and you were going from doctor to doctor to doctor to doctor, and you were getting treated individually for each symptom? It was one problem. And the problem was your immune system has flared up out of control. It has lost its ability to identify you as the good guy. And you have now become like a bacteria or a virus to your immune system. You are now susceptible to getting attacked. And that is now been determined that actually, and the way we saw this was we really weren't treating Lyme. We were treating fibromyalgia, chronic fatigue. Mostly it seemed like the chronic fatigue and the fibromyalgia patients were the ones who came in and also had a diagnosis of Lyme.
Right.
But we weren't treating them for that. We were treating them for what we understood was going to help them to get their fibromyalgia and their chronic fatigue under control. And we started noticing Lyme patient after Lyme patient after Lyme patient after Lyme patient substantially and drastically improving. There was only one explanation for it. I said to Dr. Gates one day, I won't say exactly what I said, but I said, these people have not so good autoimmune systems. And he said, yeah, I said they don't have good immune systems. I said they have crappy immune systems. And he said, no, they have autoimmunities. And this was 5 years ago. 4 years ago, 5 years ago.
Yeah, because we've seen a lot of patients where, the parents actually test positive for having Lyme disease and have no symptoms. Whereas the kid tests positive for having Lyme disease and, he has every condition under the sun and every symptom under the sun, as Dr. Rutherford is saying. So that's really when it started becoming apparent to us. Where I grew up in a wooded area where people were working in the woods all the time and none of them had Lyme disease versus, other people, they go for a hike and all of a sudden they come down with all these symptoms. When I say my relatives that have Lyme disease, what I'm saying is that they didn't really have Lyme symptoms, which raises a question, well, was it an immunity issue? And that's exactly what it is for a lot of people. And we've even seen cases where most likely they were infected 10 years before they were ever even diagnosed, and they were relatively asymptomatic until something else happened with their immune system. So there's just a
little
lot
confusing
that is to be learned about this whole Lyme disease.
And when we did the article in February, I must admit, I don't think I'm one to prone to be the naive. And I'm not on Facebook, technically. And so after we did the article, we were very excited about it. And I went on Facebook to see the comments, and I was absolutely blown away at the number of different ideas that were out there on Lyme disease and were being held passionately by folks who were still sick, and still holding on to ideas when the data is right here. And you don't know if we're telling you the truth when we say we got all these responses and so on and so forth. But we do have some testimonials online. Okay, but the data is there. And so today, there's my New Jersey coming out. Chronic Lyme disease. There is more acceptance even than there was in February on the fact that this is actually an autoimmune disease. And if you don't nail it in the first 3 or 4 weeks, then this is actually the way to go about it.
Right, exactly. So that landmark article that came out that we cited before, Journal of Autoimmunity, it's attached to today's broadcast. You can go to powerhealthtalk.com, search Lyme disease, it will come up. I think it's the 12th reference for today, somewhere in there. It's like number 10 or number 12. And so that in that article, what they showed is that individuals who have persistent Lyme symptoms, quote unquote, chronic Lyme disease, persistent Lyme disease, whatever name or nomenclature you want to put on it, they kept making T and B cell responses to the Lyme bacteria through antibody production that killed the MMP10 enzyme. So what that means in layman terms is you have kind of two sides of your immune system, T and B cells. It's way more complicated than that, but let's just think of it that way. And those who continue to have Lyme symptoms have immune responses from both sides, attacking the enzyme that helps with cartilage in your joints. So what happens? You get joint pain. But then what we attached to today's broadcast was really kind of the other literature that was maybe leading up to that landmark article coming out in 2016, where they started seeing, for example, brain behavior immunology, 2010, I believe, they started seeing antibodies to neural antigens.
Right.
In Lyme disease patients is possibly an explanation as to why a lot of you who are watching this broadcast still have brain fog. And then that was basically kind of further verified in the Journal of Neuroimmunology in 2013, where they looked at a huge group of Lyme patients versus normal healthy controls. And they saw that the inflammatory chemical messengers were much higher in Lyme patients versus non-Lyme patients, and how these inflammatory chemicals were negatively affecting the brain. So just so you know, anytime someone has brain fog, usually there's an autoimmune issue. We did a whole broadcast on brain fog, and the data was overwhelming that brain fog is an immune problem.
Right. There are multiple contributors to that.
Right.
It could be stress hormones, it could be thyroid, it could be a bad gut. There's a lot of things that contribute to that, but it is, because people are going to say, yeah, well, if it's not an autoimmune problem, how come I changed my diet? My brain fog got better. That's why, because you probably have an autoimmunity, and if you didn't know that, you should start looking for it.
Exactly.
Because it might start rearing its ugly head in other areas. So.
And really one of the best examples of this, or correlates for those of you who are trying to understand Lyme disease as it pertains to autoimmunity, is the condition called PANDAS. And PANDAS is basically a pediatric streptococcal infection. So these kids get a strep infection, strep throat,
very common.
in their throat, or they actually get around their anus. Their immune system tries to kill the strep bacteria. The immune system gets so overreactive to the strep bacteria that it actually starts making immune cells that kill dopamine in the brain. So all of a sudden these kids become hyperactive, they're flailing their limbs, they can't pay attention.
So dopamine is a calming chemical.
Yeah, and it basically
when it
helps you
goes
pay
away,
attention.
they're not calm anymore.
Right. And so here we have an infectious trigger to an autoimmune syndrome. And Lyme disease is very analogous to that. And we're not saying don't get the antibiotics if you think you have Lyme disease. Absolutely do go that course. But the problem is that, and the literature substantiates this, so many people go and get the antibiotics who still have persistent symptoms. And if you have persistent symptoms, this is exactly why. And we're even seeing in other rheumatology journals that people can develop rheumatoid arthritis after Lyme disease. So it's like what you're saying. It's Lyme disease becomes the trigger for other autoimmunity. And we see it so often that Lyme disease can be associated with Hashimoto's, can be associated, like you're saying, with other brain immune responses, because it becomes a trigger. And once we lose tolerance to ourself, meaning your immune system has millions of checks and balances to make sure that any immune cell that's going to target something like MMP10 gets killed and wiped away. And the genetics get turned off so that does not happen again. Whereas what we're seeing in today's society is that these millions of checks and balances are breaking down. We don't really know why. We don't know if it's the air, if it's the water, if it's the antibiotics, if it's the food. We don't know why.
All of them.
Could be all of them, that we're too clean, per our broadcast last week regarding microbes and autism. But all these different factors may be coming together to result in the human body in 2016, industrialized countries and societies, to break down and not be able to identify our own tissues and not attack our own tissues. So that's really the gist of what we see going on with Lyme disease. Hopefully this is informative. We did not attach a voluminous number of articles today, but I kind of wanted just to attach some really good ones. We will state for the record that this was even being surmised back in 2001, but back in 2001, they didn't know. It was a theory at that point. It was actually from the Journal of Autoimmunity. They said maybe it's molecular mimicry between Lyme and these chronic symptoms.
Explain that.
Molecular mimicry is where, let's say you eat gluten, as an example. This is the best example. You eat gluten, the gluten molecule gets a little bit through your intestines, so your immune system starts making immune chemicals to kill the gluten molecule. And then these immune cells to the gluten molecule then actually identify proteins in your nerves, maybe in your thyroid, as looking exactly like gluten. So they start attacking your nerves and your thyroid. So that's called molecular mimicry. And what they were hypothesizing back in 2001 in this Journal of Autoimmunity is that the Lyme bacteria maybe looked like the joints. Well, in actuality, they were pretty much right. Not specifically, but they're on the right path.
And to really emphasize how bizarre that is, you have a bacteria and you have a joint enzyme that look the same on a molecular level. You have a gluten molecule that is a wheat protein that looks molecularly the same as your thyroid tissue, which is an endocrine tissue, and it looks identical to your cerebellum or your nerve tissue. And so that is something that is really an amazing thing, that these molecules all look the same. And this is no small thing. I mean, we sit here on a regular basis and we meet every Saturday morning and we just we just wonder, like, what's going on here? Because what is it, 30 years that this has been developing? Maybe is it longer than that? 30, 40 years. This is a new patient population. And if you go back to the tale of Lyme that I iterated in the beginning of this, our main model of care, and we are not criticizing medicine, okay, because we are not anti-medicine, but our main medical model of care is for acute problems. And what has happened is that is transferred over. For example, the Lyme literate doctors still do use an acute model of care. I'm not cutting them down. I'm just saying that's what they took. So you're still trying to kill the bacteria. Virtually all autoimmune problems are chronic. They demanded a different type of care. And that's where functional medicine comes in. That's where functional neurology comes in. Not because they're great and wonderful and all that, but because they address the system. They address the systems from more of a long-term chronic perspective. A good functional medicine doctor, if you go to a functional medicine doctor and they're not asking you questions on what your entire history is from the time you were born and what your family's history is, they're probably going to miss something, because we're dealing with chronic issues. Chronic issues frequently start back when you're young, and then, oh, I had the strep, and then, oh, and then I was okay, and then I had these gut problems, and then I got to my high school years, and all of a sudden everything started to fall apart. Then I had a baby, and now it's off to the races. And in the end, those are dominoes that have been falling, and they're not being related. And if you're a Lyme patient, you might look back to some of those earlier issues as having helped to develop a situation in which now there was some sort of a trigger and it set you off. So the acute versus chronic understanding is vital to you if you're looking to try to determine who should be treating me for this. And you were getting ready to close this down, and I'm okay with that. But and I oftentimes am hearing these topics like 15 minutes before we come in here, so I'm listening with you. And what is the medical community suggesting for treatment, or is it just to the point of saying it's autoimmune?
It's just the point of saying it's autoimmune. I saw no suggestions at this point in all the articles I read recently on this matter, and I've been checking since February, just so you know, to see, okay, what's popping up relative to the landmark article that we referenced. Are people saying new things? There's a little bit of discussion, but there's not a lot. So,
and we assume it's going to go in the direction eventually of like steroids.
Probably immune modulating drugs.
Immune modulating drugs and,
and that's
steroids.
What I surmised.
And then there's an alternative to that in functional medicine and that field. And we've talked about it online, and we have hundreds of hours online. So you're welcome to investigate that and see if it's something that you feel connects with you and makes sense or anything like that. But it really is about the immune system. It's totally about the immune system. I've had people come in here who have interviewed to be treated for rheumatoid arthritis and wanted to know if we could help them. And then they would relay to me a story how they just wanted to get off the steroids. And they are a little confused because the steroids did help their rheumatoid arthritis, but they also lost weight, their hair got better, their gut got better, their edema and their ankles went away. And unknowingly, they had Hashimoto's and probably other antibodies to the nervous system relative to all the symptoms that had gone away. So the point of that is it's an autoimmune problem. It doesn't matter whether it's rheumatoid arthritis. It doesn't matter whether it's Hashimoto's. It doesn't matter whether it's Lyme. The treatment is the same. You modulate, or in our particular case, dampen the immune system. If there are chronic stress mechanisms also screwing up your immune system, you have to, as I like the term you used a couple of weeks ago, you have to reset that so that the immune system calms down your fight-flight mechanism. And that's the alternative route relative to doing it. And you can do that without drugs and diet, and you can do it with that and diet. And in Dr. Gates' particular case, he uses brain rehab exercises. So those are things for you to explore. They've been very successful for us, and very successful as you're not going to cure a Lyme patient, but you can sure make them feel like they want to live again and give them the control, and they can have a lot of good days and things of that nature. So So those things are possible without drugs. And so that kind of is, I think people always want to know, like, well, okay, what do I do?
Yeah.
You know, so those are kind of the two venues. It's almost going to have to come to immune modulation drugs and steroids in the medical model, because that's pretty much how that model is set up. So, so there you go.
Yeah, I think we pretty well covered it. So enjoy those articles we attach. You can access them at powerhealthtalk.com. We'll keep looking at this subject, maybe doing 6-month updates on this.
Sure.
You know, as more information comes out. And if you have any, how do we say it?
You say,
don't do questions.
You're the one who handles
we don't really
something.
do any comments because we just can't do them anymore. So if you have a specific question, you can contact our front desk about whatever your question is. But we can no longer field questions pertaining to your particular case without going through kind of a formalized procedure, because we're just getting thousands of them. So thank you for watching, and we'll see you next week.
Bye.